Welcome back to the Wellness Woodbridge Show. For the second portion of the Wellness Show, we have Dr. Siddiqi as our guest. He's an anesthesiologist that specializes in pain management, and he works at the Medical Pavilion, which is also known as First Health, I believe, and he is here with us today. Welcome, Dr. Siddiqi. We're happy to have you.
Oh, thank you. Glad to be here.
And you work, I believe, that the Medical Pavilion is affiliated with the Raritan Bay Medical Center, and it's Woodbridge's first outpatient urgent care facility, I believe. The ribbon cutting was last January, I believe, and welcome to the show.
Thank you.
Could you tell us a little bit about yourself and how long you've been part of the pavilion and practicing pain management in the community of Woodbridge?
Sure. Well, we're relatively new to the community of Woodbridge. In fact, I'm relatively new to Raritan Bay Medical Center. I've been with the anesthesia group at Raritan Bay for about, I guess this would be about month 8. And I specifically came over to practice pain management with the group since there was a paucity of that in the Perth Amboy area. So I practice anesthesiology out of Raritan Bay Medical Center, both campuses, Perth Amboy and Old Bridge. And I am subspecialty trained in interventional pain management. And I'm board certified in both, and that's what we practice. And the clinic is across the street in the pavilion, as you mentioned.
Do you go to any other facilities in New Jersey? Or?
At the moment, we don't.
Okay.
Just Raritan Bay.
All right. So speak to the audience about what services you provide at the clinic. I know that the Medical Pavilion is great to have in Woodbridge. I'm a patient there myself. You walk in, and I believe there's 3 areas there. There's an OBGYN.
Correct.
There's a walk-in clinic, and there's a physical therapy unit. And so if someone was to come to seek services from you doctors, would you have them go into the middle section or over to the right portion of the...
I'm a little more over to the right.
Okay.
The offices are all in the back, but as you mentioned, the front desk is manned by those 3.
Right.
And in between the PT and the urgent care, you'll see a little board with my name on
Oh,
it.
okay.
And some cards.
Okay.
I am in the pavilion, or myself or my partner. We're there Tuesday and Thursday afternoons from 1 to 5 p.m.
And what services do you, as a pain management specialist, what services do you render at the pavilion?
The crux of our focus is interventional pain management, and basically what that means is people with degenerative disease, mostly of the spine or any other joint, we address through a combination of interventional procedures and medications. Interventional procedures range from trigger point injections, which are done in the office, or joint injections, which can be done in the office, to more advanced things, epidural injections, which are done in the hospital setting, as well as very advanced procedures such as spinal cord stimulators.
Okay. So if someone was interested and they were having severe pain, would they have to make the appointment in advance? Because I know it's a walk-in clinic. Would they be able to just come in and request your services, or would they have to make the appointment in advance? And do you accept only certain insurances, or how does that?
The best ways is definitely to make an appointment in advance. Of course, if I'm there or my partner is there and we have a slot open and someone walks in, we'd be more than happy to see that person. We accept all insurances for the initial intake, for the meeting, for the first meeting.
Oh, that's great.
If an intervention is indicated, then it's insurance-based. Not all insurances will allow participants to have these types of procedures, so it's really dependent on the patient's insurance at that point.
Good. So if someone has a car accident and they're in really bad pain, do you specialize like in the head and neck and kind of spinal area in your practice? And is that a situation where someone could come in, and what type of treatment would you suggest? Or?
Sure, absolutely. We deal with the whole spine, from neck all the way down to your tailbone. And people who get into car accidents frequently do herniate discs or end up worsening degenerative disease, which is pre-existing. Obviously, the first thing to do if you get into any sort of car accident, other than calling the police, is, you know, if you're severely injured, you have to go to the emergency room and take the appropriate steps. Depending on where things go from there, you can come see either your primary care doctor, who often will refer you over to someone like me, a pain management specialist, or you can come directly to me, and we can address your pain and see what the next step is.
You know, this is a wellness show, and we sit on the Mayor's Wellness Committee, and it's a national committee, and you know, we're always trying to encourage exercise and, you know, eating well and all that. And I was wondering if you could give some information on what how you feel about exercise, and do you feel that exercise can prevent the pain, and just talk to the audience a little bit about that.
Oh, I hate exercise. No, of course, I'm kidding. Exercise is fantastic.
Hey, I work for the Y. Come on now.
As your previous guest mentioned, exercise is great. I think that the best advice I could give to people regarding exercise, certainly people that are, let's say, over 35, is if you're going to exercise, you definitely need to stretch properly.
Okay.
I do see a lot of people who are
advice.
weekend warriors and will jump on a bike or start running or do something where they have to exert themselves without stretching out the appropriate muscles. And that's a good way to pull a muscle and then be inactive for the next month because you're in pain.
Right.
So I think that's a good piece of advice for those that aren't exercising regularly, but whenever they have free time on a Friday or a Saturday or Sunday, might jump into something.
We just started a Woodbridge bike club, and we had our first little bike event a couple weeks ago, and there was probably about 10 of us, and a couple of people just went on too fiercely and too strongly and couldn't make it. So I can completely understand why you say you should stretch or prepare your body before you get into exercise. It's really good advice. Can you share with the audience some success stories that you have had, and how your services could really help someone who's debilitated and who can't exercise because of being in so much pain, that you've helped in your practice?
It's kind of a catch-22, being in pain. Your doctors will tell you to exercise, but obviously, or send you to physical therapy, but obviously if you're in distress, the physical therapy session or exercise just exacerbates the pain. It's kind of it turns into a vicious cycle patients don't want to. Success stories vary from very simple from my end. I have 60, 70-year-old patients that come in with a diagnosis of spinal stenosis, which is a narrowing of the spinal canal, which is probably just age-related or genetic.
And that creates pain in
the low back, usually in the lower back, but it can be any area of the spine.
Okay.
And they've gone to see surgeons, and they've been offered extensive surgical procedures, fusions and such. And some of them are very reluctant to have stuff like that, understandably. There's no guarantee that the pain is going to go away with such a thing. And they have other medical issues, heart disease, diabetes, and they're not great surgical candidates. I've helped people like that with a simple steroid injection, epidural steroid injection, and they've been pain-free for upwards of a year.
So typically, not always, I'm sure it's case to case, but a steroid injection could potentially last, depending on the patient, of course, and their condition, a year? It
can. I've had patients like that who come and see me once a year, and they get their steroid injection. It keeps them off the surgeon's table, and they're very happy.
Good, good. So do you have any other advice for people who are just in chronic pain? Do you know about fibromyalgia? Talk a little bit about that. That seems to be a very common, I don't want to say woman thing, but I feel that a lot of women in my circle, they seem to have muscle pain. I don't know if it's the age or like a female menopausal type thing, but can you speak to the audience a little bit about that, fibromyalgia, and maybe some things that could help with that?
Sure. Fibromyalgia is a diagnosis of exclusion. So all other things have to be omitted. So the more ominous things that could be causing pain have to be ruled out. And then there are very strict criteria that the American College of Rheumatology uses to diagnose fibromyalgia. You have to have certain areas of pain in certain areas of the body to qualify. From an interventional perspective, there's not much to do. There's no procedure per se for fibromyalgia, but there are some newer medications that help patients with fibromyalgia.
Now, what about your diet? I know we talked about exercise a little bit, but can your diet kind of affect pain in you, like certain things that you eat? Could that trigger some pain, not chronic pain, but?
Well, indirectly. If your diet is poor and you're overweight, the crux of that weight is borne by your spine, your hips, and your knees.
Okay.
So as you get larger, if you continue to gain weight, the burden placed on these joints increases.
Okay.
Pain levels in these joints increase. Degenerative changes in these joints increase. So if you may have needed a knee replacement at age 70 because you were 180 pounds, and now you're up to 220, maybe 70 becomes 60.
Okay, that makes sense. I know that sometimes when people eat certain things, it just gives them a bad feeling, and their joints start to ache and stuff like that.
I got great advice. Don't eat those
Don't
things.
eat those things. I guess you have to listen to your body. That's really important.
And I always tell patients, you know, I always take them at their word because no one knows your body like you do. So if something doesn't make complete sense to me from a medical perspective, but a patient is relaying that A leads to B, I give them the benefit of the doubt because they know their body, they live with it day in and day out. So, you know, there are always exceptions to the rule.
Now, initially you said you have a partner there?
Yes.
Do you want to
Sure.
share that secret?
Dr. Doug Pitchford and myself, we're the two involved in Bay pain management.
And he's also a pain management
He's also a
anesthesiologist.
board-certified anesthesiologist and pain management doctor.
Okay, and your hours there again, so that the audience, I don't know if we said if you're there every day or just
2 days a week.
2 days a week?
For now, Tuesdays and Thursdays from 1 to 5 in the afternoon.
Okay, thank you very much. Is there anything else you want to share with us that we haven't touched on, or?
No, I think we've covered most of the stuff.
good?
Thank you so much for having
Thank
me.
you very much for being our guest. We really appreciate it. And once again, Dr. Siddiqi and his partner are located at the Medical Pavilion, and that's over in the parking lot with Jose Tejas. I know a lot of people in our community know where Jose Tejas is because you cannot get in there because it's so crowded there all the time. There's a walk-in clinic there, but Dr. Siddiqi is suggesting that you call his phone number. And do you have your number on you?
Yes, it's 732-734-1310.
Thank you very much for being our guest. We appreciate you coming on the show.
Thank you for having me.